Hello again, this is Dr. Rajeentheran here, urologist from KPJ Dhammasara Specialist Hospital. My topic today is on urinary tract infection, also known as urine infection. Urine infection is quite common in ladies who are already married or are sexually active. It's very uncommon in children and adults. Now, how do patients present with urinary tract infection? They present with pain while passing urine, very burning sensation, want to rush very fast and pass urine. Very commonly urgency, before they reach toilet must quickly rush and pass urine. Sometimes they can get fever, chills, and sometimes kidney pain. Urine infection can be bladder infection, kidney infection, or testicular infection. When you have urine infection, you need to see the urologist to be treated. When you come here, what we do is we confirm the diagnosis first. We do an ultrasound, blood test, and urine test. If it's confirmed is urine infection, we start you on antibiotics. Now, for urine infection, you must come in early. If you do not come in early, you can get into severe infection or sepsis, sometimes septicemia as well. If you come in late, sometimes you have to end up in ICU. So whenever you have a urine infection or suspicion of urine infection, you need to see the urologist early. Don't keep it too long. You need to be started on the proper antibiotics. Now I'm speaking about BPH or prostate enlargement. Prostate is between the bladder and the urethra. When prostate becomes very enlarged, it can block the urination. What happens when it blocks the urination? Person can have difficulty in passing urine, getting up in the night many times to pass urine, and sometimes it becomes so bothersome that it disturbs the person's sleep. How do we confirm? We have got different ways to confirm it. We would do the ultrasound and do the uroflowmetry. Now we can give medication first. Option. Medication for prostate enlargement, but sometimes prostate enlargement become very bad, then we need to do minimally invasive surgery. We don't need to cut open the bladder and see. We need to do a scope, very minimally invasive. Within 3-4 days the patient can go back home. How do we do it? This is how exactly it is. Now this is a bladder, pundi kencing. This is the prostate. When the prostate becomes very enlarged, it blocks the urination. See, it blocks the urination. So the urine cannot come out anymore. When it blocks the urination, this prostate is being compressed. Okay? For example, this is a normal prostate. This prostate very enlarged is compressing the urination. Okay? This is a very similar effect. Now what do? We can have minimally invasive surgery. We put a scope inside here. We scrape the prostate. Scrape it, besarkan saluran ini. Okay, we do it minimally, so scrape it and make it bigger. So see, this is normal. Before that is very compressed. When we scrape it, we can scrape, make this saluran very big, and so the person can pass urine. So this is how we do the scraping. Okay, so prostate enlargement, we have got a treatment. We can start on medication first, but we must confirm its prostate enlargement. Normally when a person takes medication, after a few years it will become worse. When it becomes worse, you need to do an operation known as TURP or resection of the prostate. We don't need to do a major operation. We put in a scope, we can scrape the prostate, and then the person can get discharged within 2 to 3 days. Okay, thank you. Okay, what about the results of this operation and its cause? Now let's say for kidney cancer, we need to remove your kidney. We can do it laparoscopically. The charges will come up to almost about 25,000 and above ringgit, and usually the patient will be here only for 3 days or 5 days and then can go back home. They can immediately start walking. They can start working if they want to after 1 week or 2 weeks also. When it comes to bladder cancer is actually a major operation. They may be here for almost 5 days, 1 week in the hospital. They can walk back, they don't need a wheelchair, but maybe they go back to work within 4 weeks or so, 4 to 6 weeks. When it comes to prostate cancer, they get discharged within 3 days. It may cost somewhere around 35,000 and above ringgit, and they can be discharged within 3 days itself and start walking back.